Look, women have a lot of testosterone too. Just, I mean, the amount of hormone in their body, oftentimes more than their estrogen levels. So we kind of forget this sometimes. That also, your testosterone declines in the perimenopause timeframe as well. So, labs give women a pretty small range, and I think it's a fairly safe one for where their testosterone should be. But there are some ladies who notice quite a bit of improvement and, a little bit more pep in their step, ability to put on muscle a little bit better, some help with libido as well. That's why testosterone in women, especially in the perimenopause timeframe, has become pretty popular. They're realizing, hey, this is when I got to start paying attention to my strength training, my muscle, and my bone density. And so this is a tool when their testosterone is sitting at the upper limits of normal. I think that can be quite helpful for them. This is not new news. People, women are getting testosterone treatments, and they have been from various places for forever. But I mean, more recently in the last, I don't know, 4 or 5 years, something like that. And so oftentimes we'll see women come in here after they've been treated by another provider who maybe specializes in giving you hormone therapies with pellets in their legs. They have testosterone levels that look like mine. We have to take that, and she has to continue on with that for 3 months until those pellets wear down. There's a lot of ways to go wrong with it. We have a philosophy of start low and go slow, because even though it may take us a little bit of extra time to figure out what dose is right, you can avoid a lot of those unwanted side effects of the oily skin, acne, unwanted hair growth, and sticking with a more steady, kind of repeatable application method. Yeah, that's something I think that women have found quite useful. We've found it quite useful with a lot of patients, and how it's helped them kind of achieve their goals as well. Pellets is cool new ways to apply medications, hopefully a little bit easier. Put a pellet in you, it's going to last 3 months. Great. And I know some of them work probably just fine, but sometimes they don't, and it's also in that area where it's always hard to verify sometimes that things aren't that things are on the up and up, I guess. And so I just think if you can get your therapies through stuff that you can find at most pharmacies, compounded pharmacies for specific dosing on certain things, but high quality. I think that's kind of that area you want to stick in, that safety net. Somebody who's really watching your blood work, somebody who's watching your body composition, somebody who is there to make these, small little tweaks to the system as you move along, because sometimes it does take that. It does take some dialing in, and you have to be ready for that, but you have to also have somebody who's doing that for you.